if the patient is talking about a normal sexual experience, but maybe is weird for her, cultural, medical factors are present and consistent, these etiological factors should exclude the diagnosis of a sexual dysfunction. They send to me the patient and I send the patient back to them. Most of the time we lose the desire, also the motivation to have sexual intercourse area of the pain. And we can have mainly two situations. The pain is very localized till a visceral reaction. So we have a peak of adrenaline, body image. So we need to explore all these things. So when we finally put a diagnosis of female sexual arousal dysfunction, we will need to keep in mind at least these three things, and any biological, psychological, cultural, social, relational factors that have maybe she is very stressed with other things. Maybe she needs to take care of children all day long, or she has there is the world, there is everything here, and